Hi, Mr. Robert. How are you?
I'm feeling good.
Okay, just for confirmation, your father's name is Mr. John, right?
Yes, Mr.
Batch 16.
Yes.
Identification number 010127 120165.
Yes, that's correct.
Okay. So my name is Mohammed Mazwan. I am here to nursing student. So today I'm going to teach you how to take care of your father's urinary catheter at home. Are you okay with that?
Yes, I'm okay with that.
Okay, Mr. Robert, before we start our session, I'm going to tell you what are the learning outcomes at the end of the session. So the first one, I want you to describe the indication for the use of urinary catheter. Number two is identify parts of the urinary catheter. And the last one is I want you to explain the care for urinary catheter for your fathers at home. So the first part for our session is the indication for the use of urinary catheter. So the first one is for patient after pelvic or urinary tract surgery or prostate enlargement. So basically for this type of patient, they are going to use urinary catheter for only a few days or few weeks. Number two is incontinence or the inability to control urine flow. For this type of patient, they are going to use urinary catheter to help them pass urine, and also to avoid infection or irritability due to the uncontrolled urine that can cause skin breakdown. And the last part is for patient with urinary retention, which is the inability to completely empty the bladder after peeing. So another medical problem that may be one of the cause of urinary retention is BPH, which is benign prostatic hyperplasia. So in other words, basically his prostate is enlarged. Okay, Mr. Robert, now I'm going to show you the parts of urinary catheter. So this is what we call urinary catheter or Foley catheter. So as you can see here, this is the balloon part. So this is the bladder opening. This is the balloon part, and this is the urine drainage part. So basically, the balloon here is to hold the catheter inside the part. So in order to inflate this, I'm going to use a syringe. So inside the syringe, basically a solution to inflate the balloon using the balloon pot. So next is the drainage bag or urine bag. So this is the tubing. So this is the urine bag, and this is the drainage valve. So if you want to take out the urine from this bag, basically you just need to press this so that the urine will flow out. So after you finish, you can press it back to close the bag. Next, we are moving on to the urinary catheter cage. So now I'm going to show you what are the steps that you're going to do for your fathers at home. So the first one is to inspect the tubing to make certain that it is straight and free of kinks. So the reason behind this is basically to make sure that the urinary catheter is working and there is the flow of urine. Okay. So number two is to make sure the bag is kept below the level of the bladder. And this is to make sure that the urine will flow following the direction of gravity. Okay. So the third step is to clean the genital area to avoid any kind of infection. Number four is to follow the physician's or doctor advice and use the antibacterial soap or solution based on the doctor's prescription. So the reason is because doctor will be able to identify what type of antibacterial soap or solution according to the pH suitable to your father's skin. Number five is to follow the direction provided to notify the healthcare professional if any of the following issues arise. So the first one, you need to notify the doctor if the amount of pee gathered is less than 1 to 2 liters. Next one, if the catheter does not appear to be operating properly. Number three, look for symptoms of skin infection or irritancy, which is if you see any redness, increase in temperature around the skin, so you need to notify the doctor. And the last one, the catheter leaks urine or is unintentionally pulled out. Okay, Mr. Robert, I do understand that you might feel a little bit confused right now because a lot of steps that you need to memorize, especially the steps on how to take care of your father's urine at home. So, I'm going to give you these notes. I want you to review it at home and memorize all the steps, okay? Okay, now Mr. Robert, do you have any question?
Yes, I have two questions. So my first question is, how frequent do I need to empty the urine bag?
Okay, so monitoring the urine bag is really important. So what you can do is that when the urine bag is already third quarter full, you can empty the bag. And while emptying the bag, I want you to look for any signs of bleeding or any discharge inside the urine bag. Okay, Mr. Robert, what is your second question?
So my second question, do I need to record the volume of the urine bag or not?
Okay, of course, when you need to empty the urine bag, you also need to record the volume. So the main reason is we need to monitor your father's input and output so that we can see if there is any problem on the urinary catheter, especially when there is no urine flow. I really hope that answers your question. So now we're moving on to the review session. So I'm going to ask you a few questions and I really hope that you can answer all the questions. Question number one. So can you tell me what are the indications for the use of urinary catheter?
First one is after pelvic surgery. Second, pelvic surgery, right? And then second is incontinence, and third one is the urinary retention.
Okay, Mr. Robert. So what I have here is a part of urinary catheter. So I want you to tell me what is this?
The tubing
Okay. Next. What is this?
connected to the catheter.
Okay, that's good. So can you tell me what is the name of this bag?
The urine bag.
And the last one, can you show me how you're going to empty this urine bag?
Sure. So when I want the urine to flow out, I just press this into this side, and then the urine flow out. And then when I want to lock the urine bag, I need to press it like this. So it's done.
Okay, that's correct. Okay, the third question and the last question, can you tell me how you are going to take care of your father's urinary catheter at home?
Sure. Make sure. First one is make sure the tubing is not leaking. Second is make sure back below level of bladder. And then third one is make sure to clean the private part area. And the fourth one, use soap that is prescribed by the doctor. And if there is any abnormalities occur, I should notify and inform the doctor if there is no urine flow out or the small amount of urine. Second is if there any skin condition that is abnormal, that is show any sign of symptom to the skin. And then the catheter is not working. And the last one, the tubing is not functioning well as it was.
That's good, you're doing so well. I really hope you can take care of your fathers and I pray for your father's well-being. With that, we can end our session here. I really hope that you can learn something from this session. And thank you for your time. Thank you for your cooperation. So that's all from me. Thank you.
Thank you, Nas.